Managing healthcare business course was fantastic. It was very eye-opening, especially because I have constantly said and expressed my views on why I think sometimes we do not get to the levels we want to get in terms of excellence in the healthcare businesses and in the healthcare sector largely. So we usually have very nice and very meticulous policies. We have good frameworks that have been set, but the problem is with the implementation. Where do we start? How do we even go about ensuring that whatever we have on paper is actualized out here? So managing healthcare business has addressed that particular concern for me, and that question has answered that question, because I realized from the 4 modules we had, every other aspect, and especially the pillars, the 6 pillars of the healthcare framework according to the WHO has been addressed, which has been big for me. So this was one of the best investments I ever did or ever took for myself.
To me, it's been an eye-opener. As a facility, we're operating, I can say we're operating in autopilot. Yeah, but I think since I joined the program, one of the glaring things, the project that we have to do, made us know that we need to have a strategic plan. To have a strategic plan and implement the plan, but also to have a business model, so that it's not just a plan that we are doing, but to have a business model. We've been able to refine our vision so that it's not about us, it's about meeting a challenge and a need in the community. So that as much as we have been trying to be a premier hospital, we want to be a premier hospital providing accessible and high quality health services to the community that we serve, and that at a low cost.
Number one, I'm now sharpened as a leader. It has also opened my mind. There was quite a lot, if I can quote an example, of what really goes on behind the scenes in the pharmaceutical world. How the people how the manufacturers, invest a lot, and sometimes some of the methods they're trying to use to advance their business, they're not ethical in nature. That has really opened my eyes, and it has really opened the eyes of my colleagues whom I work with.
I don't think there's any module that wasn't beneficial for me, but the one that stands out really was on healthcare and technology. There's also service delivery. This totally stood out for me, and my takeout is also for, there's so many players in the health sector right now in the industry, and especially pharmaceutical industry. The issue of brand visibility is something that has stood out for me, because it means that young players who are coming up now in this particular industry are able to, get known by increasing their brand visibility, and we were given strategies of how to do that in the managing healthcare businesses.
I enjoyed most being with my colleagues. You find people who've been in the business longer, who've worked in the healthcare business industry from a different facet. Some are in the urban, some are in the rural, some are successful in the rural more than we are. I've been given contacts for various pharmaceuticals that can assist me, and I've gained friends and people that I can reach to when I have a challenge. So for me, the most thrilling bit of it was being able to gain contacts from the class members.
What I enjoyed the most was, of course, being in a class full of intellectuals. These people know exactly what they are doing, they have experience, and the fact that, it was a very interactive class.
I'll tell my colleagues about the program because the advantages are myriad. There are many advantages we've gained so far. And I think it's not just for the CEO. I think even for for the facilities, some of the key employees they have should come for this. And I've learned that from Oasis. The CEO has not come. I think he did his earlier, but now we've been with almost 6 of staff from Oasis. I came with my administrator, and I think we now have a harmony of vision, and we've done it has also helped us to plan together and to try and execute things together with a clarity that was not there before. So I would urge those who are in the healthcare business, I would encourage them, because this makes you see healthcare business in a different perspective.